probably already watching what you eat. You read the labels, you've cut back on sugar, maybe you swapped white bread for whole grain, and you gave up sweet tea years ago. You've done everything the pamphlet told you to do, and yet your fasting glucose is still climbing. Your A1C came back higher than it was 6 months ago, and your doctor looked at the number, adjusted your metformin dose, and moved on before you could even ask a follow-up question. Here's the part nobody is telling you. The food choices that move blood sugar aren't just about cutting things out. It's about what you're adding in, when you're eating it, and how specific nutrients interact with insulin, with your gut, and with the way your cells actually absorb glucose. Most people managing type 2 diabetes or prediabetes are operating on advice that is 2 decades out of date, and there is now a substantial body of research pointing to specific foods that do measurable, documented things to fasting glucose, post-meal spikes, and insulin sensitivity. Not vague wellness claims, actual mechanisms. The difference between a 140 reading 2 hours after dinner and a 98 reading can sometimes come down to what was on the plate, not just what wasn't. Today, I'm going to change that. My name is Dr. Mark, and this channel exists to give you the kind of clear, practical, honest health information that too often gets left out of a 10-minute appointment. If you're managing blood sugar or you love someone who is, you're in the right place. Before we go any further, I want to know who I'm speaking to. Drop your first name and where you're watching from in the comments below. I genuinely read them. It helps me understand who's in this community, and it matters to me. Margaret was 68 years old, a retired high school librarian from outside of Columbus, Ohio. She was the kind of woman who kept a notebook. She logged her blood sugar every morning before breakfast, wrote down everything she ate, tracked her steps on a wristwatch that her granddaughter helped her set up. She had been living with type 2 diabetes for 7 years. She took metformin twice a day without fail. She had been told repeatedly that she was a model patient, and then her A1C ticked up to 7.9. Not catastrophic, but moving in the wrong direction, and she couldn't understand why. She'd eliminated most processed foods. She walked 30 minutes every morning. She'd stopped buying anything with corn syrup on the label. She thought she understood what she was supposed to be doing. She was exhausted, but she kept going. What she didn't know was that the bowl of instant oatmeal she ate every single morning, the one she'd switched to specifically because someone told her oatmeal was good for diabetics, was spiking her blood sugar higher than a scrambled egg and a slice of avocado would have. She didn't know that the orange juice she drank alongside it, even though it was 100% juice with no added sugar, was delivering a fructose hit that her liver was converting almost directly to blood sugar. She didn't know that the timing of her walk mattered enormously, that 30 minutes after dinner would do 3 times more work than 30 minutes before breakfast. Nobody had ever sat her down and explained the difference between foods that raise the glycemic index and foods that blunt the insulin response. Nobody had explained the role of resistant starch, or soluble fiber, or magnesium, or polyphenols. Her doctor managed her numbers. Nobody had ever managed her understanding. The changes that eventually turned her A1C around were not dramatic. They were specific, and they were all things she could have started on a Tuesday. But Margaret didn't know them because nobody had ever explained the actual mechanism behind why food does what it does to blood sugar. Let's start with the one food category that has the most consistent, most replicated research behind it when it comes to glucose management. And it's probably not what you're expecting. It's not leafy greens, it's not berries, though we'll get to those. It's legumes, beans, lentils, chickpeas, black-eyed peas. The research on legumes and blood sugar goes back decades, and what it shows is not subtle. A cup of cooked lentils has a glycemic index around 32. For comparison, white rice sits around 72, and instant oatmeal, yes, the heart-healthy breakfast staple, it's somewhere between 65 and 83, depending on the brand and how it's processed. What that number means in practice is this. When you eat a food with a high glycemic index, glucose floods into your bloodstream quickly. Your pancreas fires a surge of insulin to catch it, and then, Especially in someone with insulin resistance, you get the crash, the hunger, the fatigue, and the next spike waiting around the corner. Legumes do the opposite. They are full of soluble fiber, which forms a gel in your digestive tract that physically slows the absorption of glucose. They contain resistant starch, a type of carbohydrate that bypasses your small intestine almost entirely and feeds the beneficial bacteria in your colon instead. And they have a protein and fat content that further blunts the post-meal glucose curve. The common misunderstanding is that beans are a carbohydrate, so they must raise blood sugar. And technically, yes, they are a carbohydrate, but the physiological response to a half cup of black beans is entirely different from the response to a half cup of white rice, even though they have similar calorie counts. People hear carb and lump everything together. The mechanisms are completely different. What you are looking for is not the total amount of carbohydrate, it's the speed at which it becomes glucose in your bloodstream. The dangerous misreaction is this. Because legumes are labeled a carbohydrate on a food tracker app, many people managing diabetes avoid them. They reach for low-carb alternatives, sometimes processed protein bars, sometimes high-fat snack foods that do nothing to improve insulin sensitivity and may introduce their own problems. Others see legumes listed in a foods to limit category somewhere online and stop buying them entirely. That's the wrong call. That's cutting out one of the most well-documented blood sugar moderating foods in existence based on an incomplete understanding of what carb actually means. What should you do instead? Add legumes to 3 or 4 meals a week as a foundational component, not a side dish. A cup of cooked lentil soup at lunch, black beans folded into dinner, hummus, which is chickpeas and olive oil, as a snack instead of crackers. Aim for half a cup to a full cup per serving. Give it 4 weeks of consistency and recheck your 2-hour post-meal readings. The data will tell you what's happening. But none of that happens if you suffer in silence, thinking carbs are carbs. If you've ever been confused about beans and blood sugar, or been told to avoid them, drop a comment below. You'd be surprised how many people have gotten this same contradictory advice and never received a clear answer. Now let's talk about vinegar, specifically apple cider vinegar, but the mechanism applies to any vinegar with acetic acid concentration above about 5%, which includes most white wine vinegars and red wine vinegars as well. The research here is small but consistent. A tablespoon or 2 of apple cider vinegar diluted in water taken before or during a high carbohydrate meal has been shown in multiple small trials to reduce post-meal blood sugar by anywhere from 20 to 35% in people with type 2 diabetes and insulin resistance. That is not a negligible number. That is a meaningful reduction in the glucose spike that follows a meal. Here's the mechanism. Acetic acid appears to inhibit certain digestive enzymes, particularly alpha amylase, which is responsible for breaking down complex carbohydrates in the small intestine. Slow the enzyme, you slow the conversion of carbohydrate to glucose, which means slower absorption, lower peak, gentler insulin response. There's also evidence that acetic acid improves insulin sensitivity at the cellular level by activating a protein called AMPK, which plays a role in glucose uptake in muscle tissue. The misunderstood side effect is this. Some people start taking undiluted apple cider vinegar by the spoonful because more seems like it should do more. Undiluted vinegar, taken regularly, can erode tooth enamel and irritate the esophagus. It is not benign when taken incorrectly. The correct way is always diluted, 1 to 2 tablespoons in at least 8 ounces of water. The timing matters too. The research shows the most pronounced effect when it's taken immediately before a carbohydrate-heavy meal, not an hour earlier and not 2 hours later. The dangerous misreaction is substituting vinegar for medication, or using vinegar to justify eating foods that would otherwise create large spikes. Vinegar is an adjunct. It blunts a spike. It does not eliminate the blood sugar response to a large plate of pasta. Use it as one tool alongside, not instead of, the foundational dietary changes. What should you actually do? Keep a small bottle in the kitchen. Before your most carbohydrate-dense meal of the day, usually dinner, mix 1 tablespoon in 8 ounces of water and drink it with your meal. Track your 2-hour post-meal reading for 2 weeks with it and 2 weeks without. Let your own data guide whether it's making a meaningful difference for you specifically. And if nobody has ever explained the enzyme mechanism behind something as simple as vinegar this clearly before, hit that subscribe button, because what's coming next is the part of this conversation that most people have never heard, and it may be the most important safety information in this entire video. Let's talk about magnesium. Not because it's trendy, because the research connecting magnesium deficiency to insulin resistance is among the most consistent findings in metabolic health over the past 20 years, and the majority of adults managing type 2 diabetes are deficient in it, often without knowing it, because most standard blood panels don't test for intracellular magnesium, only serum levels, and those numbers can look normal, even when the cells themselves are depleted. Magnesium is a cofactor in over 300 enzymatic reactions in the body. 2 of the most critical for blood sugar management are the reactions that allow insulin to bind to its receptor on cell surfaces, and the reactions that allow glucose to be transported into muscle tissue after that binding occurs. Without adequate magnesium, insulin knocks on the door and the door doesn't open correctly. You can have adequate insulin levels, even elevated insulin levels, and still have glucose piling up in the bloodstream because the cellular machinery needed to respond to insulin isn't functioning properly. The foods highest in absorbable magnesium are not the ones most people reach for. They are pumpkin seeds. A single ounce contains roughly 37% of the daily recommended intake. Dark leafy greens like Swiss chard and spinach, especially eaten raw or lightly cooked, not overcooked. Dark chocolate above 70% cacao. Almonds and cashews. Wild-caught mackerel and salmon. Black beans, which we've already talked about. The misunderstood risk here is that people hear dark chocolate and take it as permission to eat any chocolate. The threshold matters. Below 70% cacao, you are primarily getting sugar and dairy fat. Above 70%, you are getting flavonols, polyphenols that independently improve endothelial function and insulin sensitivity, plus meaningful magnesium. 1 ounce of 85% dark chocolate has approximately 65 milligrams of magnesium and a glycemic index below 25. It is not a blood sugar food in the way people assume it is. The dangerous misreaction is supplementing magnesium at high doses without medical supervision. Magnesium at doses above 350 milligrams in supplement form can cause diarrhea, cramping, and in people with compromised kidney function, which is common in long-term type 2 diabetes, can accumulate to dangerous levels. The goal is food-first magnesium, with supplementation only under the guidance of your physician and with a baseline intracellular magnesium test, not a serum level alone. Ask your doctor specifically, can we test my intracellular red blood cell magnesium level, not just the standard magnesium panel? That single question could open a conversation that changes how your insulin resistance is managed. But none of that happens if you suffer in silence, thinking magnesium is just something in a bottle at the pharmacy. Here's where it gets counterintuitive. There is a product on the market, arguably one of the most health-coded products in America right now, that is quietly creating meaningful blood sugar problems for people who are doing everything else right. That product is a large fruit smoothie. Not fast food, not candy, a smoothie made with real fruit, often with added yogurt or protein powder, often marketed as a meal replacement or a post-exercise recovery drink, often purchased or made at home by people who are actively trying to manage their blood sugar. The problem is concentration and speed. When you eat a whole apple, the fiber in the apple, both the soluble fiber in the flesh and the insoluble fiber in the skin, physically slows how fast the natural fructose and glucose in that apple reach your bloodstream. Your blood sugar rises gently and over a longer period. When you blend 4 pieces of fruit, strip out the fiber through the blending process, and drink it in 4 minutes, you are essentially creating a fructose delivery vehicle. The gut absorbs it quickly. The liver sees a fructose hit it wasn't expecting. Blood sugar climbs faster than it should. Post-meal readings and studies comparing whole fruit to blended fruit of identical calorie content are consistently worse for the blended version. This affects people who believe they've made a smart choice. Think about someone in your life right now who is managing prediabetes, who starts every morning with a green smoothie or a fruit blend, who would be genuinely confused if they saw their 2-hour post-smoothie glucose reading. They're not doing anything wrong by intent. They've been told fruit is good. Nobody explained that the delivery mechanism changes everything. It's not prescription-only products nobody thinks to mention. The smoothie on the counter is exactly why they matter. Here's a scenario I want you to visualize for a moment. It's a Tuesday evening in July. It's hot, the kind of humid heat that sits on you. You didn't sleep well the night before. You made dinner, but your appetite was off, so you ate less than usual. Around 8 p.m., you start to feel lightheaded. Your hands feel a little shaky. You take your blood sugar and it reads 71. You know that's low. You know you need to bring it up. And so you do what seems completely logical. You drink a glass of orange juice because you've always heard orange juice fixes a low. And it does. But an hour later, your reading is 210, and you don't understand how a number could jump that far. This is the overcorrection cycle, and it is one of the most common, least discussed sources of blood sugar volatility in people managing diabetes at home. The fix for a mild low of 71 does not require 12 ounces of juice. It requires 15 grams of fast-acting carbohydrate, which is 4 glucose tablets, or 4 ounces of juice, or a tablespoon of honey. That's the rule of 15. 15 grams, wait 15 minutes, recheck. If the number has not come up to above 80, you take another 15 grams. The next time you see your doctor, ask this specific question. What is my target for treating a mild hypoglycemic episode, and what specific food should I use to treat it? Get a written answer. Put it on your refrigerator. There is one more thing I want to address before we close, and it doesn't get discussed enough. It's the dizziness that some people feel 30 to 60 minutes after eating. Not before eating, after. A kind of heaviness in the head, a brief unsteadiness when standing up from the table. People dismiss it almost universally. It passes in a minute. It feels minor. So they chalk it up to getting older or to standing up too fast, and they move on. What is often happening physiologically in a person managing type 2 diabetes is a postprandial blood pressure drop, a shift in blood flow toward the gut to support digestion that, in combination with blood pressure medications that many people in this demographic are also taking, and the volume shifts associated with blood sugar fluctuations, creates a brief but real window of circulatory instability. That window, 30 to 60 seconds of reduced cerebral perfusion, is when falls happen. Not dramatic fainting, just a slightly misjudged step, a hand that reaches for the counter a half second too late. This isn't alarmism. This is blood pressure and blood sugar working together in a way that demands respect. The simple fix is this. When you finish a meal, don't stand immediately. Sit for a full 2 minutes. Stand slowly. Pause with your hand on the chair for a count of 5 and then walk. That's it. But the simple fix isn't always enough. If you are experiencing that dizziness consistently, more than twice a week, that is a conversation to have with your prescribing physician about the combination of your diabetes medications and your blood pressure medications, and whether the dosing still makes sense as your diet improves and your baseline numbers change. And if you've made it this far and you're getting something real from this conversation, type the number 9 in the comments. It tells me you're here. That's all I need to know. There's one thing I want you to take away from everything we've covered today. And it is this: blood sugar management is not about deprivation. It is about mechanism. Every food choice you make is either slowing glucose into your bloodstream or accelerating it, either supporting your cell's ability to respond to insulin or undermining it. Legumes, vinegar, magnesium-rich foods, the timing of a walk, the way a piece of fruit is prepared before it reaches your mouth, these are not wellness abstractions. They are physiological levers you now understand how to use. Margaret's A1C came down, not because she ate less, because she ate differently, and more importantly, because she finally understood why. That understanding is not a luxury. It is the thing that makes the effort sustainable. I'll see you in the next one.